Welcome to Mighty Mornings. I'm Mary.
And I'm Lindsay. Let's dive in. We all know that fighting inflammation is important and a hot topic these days. But there's a lot of ways that we can fight inflammation, and today Dr. Tam is going to tell us a few ways that we can make sure that our inflammation is at bay. Welcome, Dr. Tam.
Welcome back, Mighty Family, to another Dr. Eric Debunks. Today, I want to dive in and discuss all things related to inflammation. If you've ever experienced pain, redness, swelling, or warmth, you have likely experienced inflammation in your body. Inflammation is a normal response, but when it gets out of control, that's when we run into problems. A lot of our Mighty Health members have asked about what can we do in our day-to-day to decrease inflammation in our bodies. So today we're gonna jump into all things we can control to decrease inflammation. But first, let us understand what the inflammatory process is. Let's just say you were in the kitchen and was slicing up an onion you were about to use to saute with some ground beef. Unfortunately, you were distracted by someone knocking on your door, and all of a sudden your knife slipped and you end up slicing into your index finger. The second that cut happens, your body begins to go into an inflammatory process. Right away, the blood vessels in that area that were cut open will constrict, helping reduce bleeding. Then it is followed up by vasodilation of surrounding blood vessels to increase blood flow to the area, which leads to the area becoming red and warm to touch. Next, the blood vessels in the area will become more permeable, allowing fluid, proteins, and immune cells to exit the bloodstream and enter the tissue, causing swelling of the skin. The immune cells, however, do serve a purpose in that they're trying to destroy any bacteria or pathogens to prevent infection in the area. In addition, they also help clean up any dead skin or debris. Soon, the damaged tissue starts to heal. New blood vessels form to provide oxygen and nutrients to the area, allowing skin tissue to reform. And soon enough, the wound is closed through the formation of new skin cells. Once the healing process is complete, the inflammatory response gradually subsides. The immune cells withdraw from the area, and the blood vessels return to normal. In some cases, a scar may remain because of the tissue repair. As you can see, once there is injury, redness, warmth, and swelling, the pain starts to follow. It is a necessary process to promote healing. However, excessive or prolonged inflammation, on the other hand, can hinder healing and lead to complications. I recently met a new patient in my clinic. She was 65 years old and generally good health. But upon meeting her, she had confided in me that her hands have been hurting for over a year. It was worse when it was cold, so she would often wear gloves. As I removed the gloves, I was quite shocked with what I saw. Her joints were severely disfigured. The joint, particularly above her knuckles, were severely swollen and warm to touch. Right away, I had a suspicion for an inflammatory arthritis. After some blood work and x-rays, it was confirmed that she had rheumatoid arthritis, an inflammatory autoimmune joint disease. In this disease, the immune system is mistakenly attacking the body's own tissues, particularly the joint space. This then triggers the inflammatory response we described above, leading to redness, pain, swelling, and warmth. And because this inflammatory response became chronic, it not only damaged the joints, but also the bones itself. If this is left untreated, it can lead to severe joint deformities, loss of function, and even disability. Although at this time her inflammation was localized to her hands, it is important to recognize that chronic inflammation can impact any part of your body. For example, people that suffer from chronic inflammation of the gastrointestinal tract may develop inflammatory bowel disease, such as Crohn's disease or ulcerative colitis. Or people that have chronic inflammation in the lungs may develop COPD or chronic obstructive pulmonary disease. What I want to emphasize here is that if you happen to notice any new symptoms of inflammation, such as pain, swelling, redness, and is persisting for weeks into months, please don't hesitate to reach out to your primary care providers. This way, further tests can be done to make sure there aren't signs of chronic inflammation that is damaging your body. All right, now that we explained the inflammatory process and the damaging effects of chronic inflammation, let's talk about what we can do about it. So certain foods have been associated with anti-inflammatory properties and may help in reducing inflammation in the body. The message I really want to preach here is seeing food as medicine, but without the side effects. What we put in our bodies on a daily basis matters. So why not give it what we know helps the body feel good? So here are some common foods that are known to have potential anti-inflammatory effects. So fatty fish, such as salmon, mackerel, sardines, and trout, are rich in omega-3 fatty acids, which have been shown to reduce inflammation in our bodies. Even if you can incorporate one meal a week of fish, that would be a great start. Berries such as strawberries, blueberries, raspberries, and blackberries are packed with antioxidants and phytochemicals that possess anti-inflammatory properties. So think about how you can incorporate them throughout the day as a light snack. Dark leafy greens like spinach, kale, Swiss chard, and collard greens are rich in antioxidants and contain nutrients like vitamin E, C, beta-carotene. All these compounds have been associated with reducing inflammation. Turmeric, a spice commonly used in curry dishes, contains a compound called curcumin. Curcumin has anti-inflammatory effects in various studies and may help in reducing inflammation in the body. One way I personally incorporate turmeric in my diet is in the form of a tea, and I've found it especially enjoyable after a meal. Extra virgin olive oil is a healthy fat that contains a compound called oleocanthal, which has been found to have anti-inflammatory properties similar to non-steroidal anti-inflammatory drugs such as ibuprofen. Nuts like almonds, walnuts, pistachios are rich in healthy fats, fiber, and antioxidants. So instead of reaching for snacks like chips or sweets, nuts are a great replacement. Green tea contains catechins, which are antioxidants that have been shown to have anti-inflammatory properties. Regular consumption of green tea may help in reducing inflammation. Tomatoes are a rich source of lycopene, an antioxidant with potential anti-inflammatory properties. Cooking tomatoes and consuming them with a source of fat, like olive oil, can enhance absorption of lycopene. Ginger has been used for centuries for its medicinal properties, including its anti-inflammatory effects, as well as its benefits to the digestive system. It can be consumed fresh, powdered, or as a tea. Dark chocolate, with a high cocoa content, 70% or higher, contains flavonoids that have been associated with anti-inflammatory effects. Enjoying dark chocolate in moderation may offer some potential benefits. So as you can see, there are a lot of common foods we eat that have potential positive effects on reducing inflammation in your body. More so, these are the common foods that are just great in general. So I would advise incorporating them into your regular diet, if not already. All right, now let us talk about lifestyle changes that can help decrease inflammation in the body. The first is probably to no surprise to anyone, and that is exercise. I don't want you to just take my word for it though, so I want to explain how it works. Exercise can decrease inflammation in the body in various ways. So first, regular exercise can decrease visceral fat, which is the fat that surrounds the organs in the abdominal cavity. Excess visceral fat is associated with increased inflammation. Physical activity also improves insulin sensitivity, meaning that the body cells become more responsive to insulin, which is a hormone that regulates blood sugar levels. Insulin resistance is associated with chronic inflammation, and by improving insulin sensitivity, exercise helps reduce inflammation. Third, exercise stimulates the production of anti-inflammatory chemicals in the body, and these chemicals help regulate the immune response and dampen inflammation. And lastly, regular exercise has been associated with a healthier gut microbiome, which refers to the community of microorganisms in the digestive tract. A balanced and diverse gut microbiome is linked to lower levels of inflammation in the body. All right, the second lifestyle change that can make a big difference in inflammation is adequate and restful sleep. And here are some ways where sleep can decrease inflammation. So during sleep, the body undergoes various restorative processes, including the regulation of cytokines. Cytokines are signaling molecules involved in the immune response, and their dysregulation can contribute to inflammation. Sufficient sleep promotes a balanced production of cytokines, helping to mitigate inflammation. Sleep allows the body to recover and repair cellular damage, including reducing oxidative stress. Chronic oxidative stress can lead to inflammation. Quality sleep supports the body's antioxidant defense mechanisms, helping to alleviate oxidative stress and reduce inflammation. Sleep is also involved in regulation of various hormones, including those that impact inflammation. Inadequate sleep can disrupt the balance of hormones such as cortisol, which can contribute to increased inflammation. Sufficient sleep promotes proper hormonal regulation, therefore supporting an anti-inflammatory environment. So sleep is essential for really proper functioning of the immune system as well. During sleep, the immune system strengthens its defenses, including the production and activity of immune cells. This immune restoration helps to counteract inflammation and maintain a healthy immune response. I know as physicians, we are always preaching getting a good night's rest and exercise, but as you can see, there's good reason for it. I hope the explanations above can further incentivize you to prioritize restful sleep daily, as well as incorporating exercise on a regular basis. All right, Mighty family, that was a ton of information from me, so let me summarize everything into a few mighty takeaways. So number one, inflammation is a normal response in the body to protect you, to help you repair and heal your body after injury. Inflammation becomes dangerous when the body chronically undergoes this inflammatory process, leading to damage. Two, if you're noticing new pains or swelling in your joints or chronic warmth in parts of your body, don't delay paying your primary care doctor a visit, as it is important to make sure you're not dealing with an inflammatory condition. Three, see food as medicine. There are so many common foods that have shown to help decrease inflammation. So lean into your fatty fish, your dark leafy greens, and even give ginger turmeric tea a try. And lastly, it is the simple things that make a huge difference. Exercise can help decrease inflammation in our bodies and keep it in balance. In addition, getting a good night's rest can absolutely help keep your body's inflammation at bay. All right, Mighty family, this wraps up our segment for today. As always, I look forward to connecting with you all again soon. For those that are not a part of the Mighty family just yet, check us out at mightyhealth.com for more. We're striving every day to be the modern holistic home for healthy living.